Former President George H.W. Bush offered his condolences to the Kennedy family. He issued this statement. Barbara and I were deeply saddened to learn Ted Kennedy lost his valiant battle with cancer. While we did not see eye to eye on many political issues through the years, I always respected his steadfast public service. So much so, in fact, that I invited him to my library in 2003 to receive the Bush Award for Excellence in Public Service. Ted Kennedy was a seminal figure in the United States Senate, a leader who answered the call to duty for some 47 years, and whose death closes a remarkable chapter in that body's history. Barbara and I and all of the Bushes send our heartfelt condolences to Victoria, Ted's kids, and the entire Kennedy family.
And Congressman Ron Paul is with us this morning. Thank you so much for coming in.
Good morning.
Thank you. I know that you were here to talk about health care reform, and we are definitely going to talk a little bit about that. But because of this news this morning, the surprising news, I want to know what your reaction is.
Well, the reaction is always sad to see or hear of anybody's death, and the Kennedys certainly have suffered in that regard. I never met any of the Kennedys, so I never knew any of them personally. But, you know, the health care issue is very important right now, and Ted Kennedy was very much involved. In some ways, this might be a real boost for getting Obama's package passed. All of a sudden, people might say, well, in honor of Ted Kennedy, we have to pass this. And that's more or less what President Johnson did after President Kennedy died, is that all of a sudden he used the death of President Kennedy to promote the agenda that at that time President Kennedy wasn't able to get through. So it may be that this is going to get a shot in the arm for those who want to, you know, nationalize more so our health care system. And for those of us who aren't exactly anxious for that, that might be a benefit to our opposition.
Ted Kennedy had a lot of influence in the Senate, but how much can a person be influential in trying to get legislation passed, whether it be in the House or in the Senate?
Well, I think he'll have more influence in his death than he would have on the Senate floor, because the American people are strongly objecting to the program. But at the same time, there's a lot of emotionalism. Take, for instance, the emotionalism following 9/11. Legislation that had been proposed for years and years, which was packed into the Patriot Act, you know, it couldn't be passed. But the emotionalism and the fear and the concerns of 9/11, all of a sudden that was passed without even reading the bill. So, you know, public emotions are very important. Sometimes we even go to war under public emotions without thinking things through. So this is something I've always argued for. It's a full debate, and this is what the American people are so upset about right now is, why don't you guys read the bills? Well, most of the time we don't read the bills because we don't get them, even on this medical bill. It's liable to pop up a week or two or three after we get back, and really there isn't a precise bill. There's a Senate bill, there's no Obama bill, there's a House bill that's recently been amended by 200 amendments, and what they give us at the last minute might not be available to us. So it's this kind of operation that Congress is involved in that is so upsetting to the people.
And where do you stand? Because there's a new poll out that says that President Obama only has about 49% of support for this health care reform bill, which is opposed to the 60% that he had. So people are starting to lose faith.
I think so, and I think that's going to continue unless the emotions grab us and change this direction. But I think it's the fact that people are starting to recognize the failure of government because of the failure to protect us against this massive financial crisis. And then we rush again without thinking it through, and we pass a bill over my objection of a $700 billion TARP fund to bail out the financial system. We find out that wealthy executives get big bonuses, and the American people say, where's all this money going? And then Congress says, oh, we'll check it out after the fact. So people are very annoyed by that, and now they're saying, well, they hear stories that Social Security really isn't solvent, and Medicare is broke, and Medicaid doesn't have enough money. TARP funds are wasted. They hear the Federal Reserve spends trillions of dollars, and they're not even audited, and they're starting to suffer. The true unemployment rate is 20%. People are really hurting around the country, and they're saying government's not very successful. So why should we turn this over to an agency, the government, that runs the post office in deficits, run Amtrak in deficits, and then they come up with clunker programs that are supposed to revive the economy. The American people are rightfully very skeptical of what government is giving them right now.
Congressman Paul, last question. Do you see a compromise because of the death of Kennedy for a reform to health care?
Yes, I do. I think that's what's going to happen. They're going to use some emotionalism there. They're going to back off. And this is not profound. This is just what happens, that when there becomes a conflict like this and it gets out in the open, reality sets in, and they'll come up and it'll be another incremental step for bigger government, which is something I object to. The incrementalism is just as dangerous. Whether you get someplace over 10 years or 1 year, you're still getting there. If it's a wrong direction, it's wrong altogether. But I think incrementalism is still there, and that we will get more government, it'll become more expensive, and the people will become less satisfied.
Well, time will tell, but we'd like to really thank you for spending time to come in for Fox 26 Morning News.
Thank you very much for having me.